And my last couple of sessions, and then I can have, be very happy to have some question, is what about a healthcare worker should knows about diabetes? I mean, and I think that the message is important, is that clearly diabetes is a group of disease marked by high glucose levels. Diabetes is more common in obese people. But the other issues is that symptoms of diabetes are vague and and they are common. So increased thirst, increased urination, blurry vision, weight loss, they can happen. They are symptoms of diabetes. And we know that worldwide, about half of diabetics are still undiagnosed. And of course, if you don't have the diagnosis, you cannot treat diabetes. And untreated diabetes can cause high kidneys, nerve damage, amputation, and heart attacks. So knowing about this is very important. About, as I mentioned, the symptoms of diabetes: increased thirst, dry mouth, unexplained weight loss, increased hunger, nausea, frequent urination, fatigue, blurry vision, frequent infection, and numbness or tinglings in the hand or feet. So those are important symptoms to know and to inquire about patients. Clearly, the risk for patients developing diabetes is age of over 40, being overweight, physically inactive. This is very important. I think a family history of diabetes is a very powerful risk. Women that had the gestational diabetes clearly are at high risk of developing type 2 diabetes. In most studies, half of these women will develop type 2 diabetes down the road. And of course, women with gestational diabetes, they tend to have heavy babies. And so a woman had a baby weighing more than 9 pounds is another risk factor for developing diabetes. The other thing that is very essential is that the exercise is incredibly beneficial in diabetes. It's good for all of us, but especially for patients with diabetes. It improves glucose level, but also has been shown to improve heart disease, to reduce cholesterol, to reduce blood pressure, to decrease obesity and prevent type 2 diabetes. So that is really important. And the other thing that is important is that patients with diabetes, they really should know what their blood pressure, cholesterol, and glucose control as A1C levels are. These are very important numbers to know. Now, there are a lot of medication for diabetes, as we discussed. There are a lot of different pills for more advanced cases in the sense of more insulin deficiency. Insulin is usually necessary, and insulin so far is not absorbed into the stomach because it's a large molecule, needs to be given as an injection. There have been, now in the US, we have an inhaled insulin that really no one uses, but cannot be given by mouth. The problem with insulin is that too much or too little insulin can cause hypo or hyperglycemia, so it's important to find the right balance. And patients using insulin, they can use a glucose meter to measure the blood sugar level to be known that they are not hypoglycemic. And the other thing is important is that while there are symptoms, as we discussed, of high glucose, feeling weak, tired, frequent urination, but also especially for patients on insulin, knowing what are the symptoms of hypoglycemia are really important so they can be treated right away. And lastly, what is the general population, what patients should know about diabetes? Again, the similar thing. So the fact that diabetes is a group of disease that is characterized by high glucose levels, more common in obese people, that the symptoms are vague: blurry vision, increased urination, weight loss. And then diabetes can cause all these complications. But I think what I always try to emphasize to my patient that the treatment of diabetes can prevent of this complication. And actually, over the last couple of years, nationwide data from the US have shown that the prevalence of heart attack, stroke, and end-stage renal disease in patients with diabetes has come down quite significantly. And of course, knowing what are the risk factors of diabetes, unhealthy eating, overweight, family history, lack of exercise, that is important. Now, what do a patient needs to do to take care of diabetes is try to control the blood sugar every day. Stop smoking is another important component, since smoking is such a strong risk factor for heart disease, and diabetes is another very strong risk factor for heart disease. Being active and keeping a healthy weight, eating fewer fatty food, trying to control cholesterol by diet and exercise is important, and also take the medication as prescribed can clearly prevent all the end-stage organ disease that is associated with diabetes. That is absolutely essential. And so exercise can reduce the risk of diabetes for patients that are at risk, and we have shown from the prevention study that 30 minutes of exercise a day can reduce the risk of developing diabetes by almost 50%. So that is absolutely important. And of course, taking the right medication. Medication come in different way, shape, or form, insulin or pills. Patient don't like to take insulin injection, and for a long time we can avoid that with pills, but then eventually that is what is needed. And for patients with diabetes, I always ask them to know that they should control all their factors, both the A1C, so glucose level, blood pressure, cholesterol, and stop smoking. Those are very important components that can prevent chronic complication of diabetes.